Happy New Year, everyone. It's 2024. I'm Dr. Jodie Ann Senior. I'm a heart failure specialist. Thank you for joining me. If you want to subscribe to this playlist, it's a roadmap for your journey in heart failure. What I'm here to do is to help educate you so that you get a full understanding of what's available to you as a heart failure patient and how you can best support your care and advocate for yourself to get the best therapy possible and the best outcomes possible. And we have been talking about drug therapy. So, if you want to look back at why are you on these drugs and what are they going to do, please go back through the playlist and look for the individual categories. They're 8 to 10 minute discussions, nothing too arduous, and hopefully they're in a way that you can understand. So just as a little summary of what drug therapy might look like, the kind of primary type drugs that we would use would be maybe a diuretic, maybe something like ARNI, which is one of the newer categories of drugs previously explained. Beta blockers, the specialized heart failure ones, not the regular ones. Something like ivabradine, which is an F channel inhibitor. SGLT2s, which although are diabetic drugs, have been shown to improve mortality in heart failure. And that's just like a brief kind of look at what the list might look like. Obviously yours may be very different depending on your particular circumstances, but those are core therapy drugs. The diuretics tend to be things like furosemide or Lasix, could be spironolactone or aldaptone. There are various other ones, but these are to help manage the fluid balance, which is quite critical along with your medications. If you don't get your fluid balance right, then it makes it really hard for the other drugs to do their job properly because they're not absorbed as well, etc., etc. So this is a critical thing that we'll be going over later in the program. So I'd urge you to subscribe so that you don't miss that, because that's a really important discussion. So your list may look a little different to that. It might look essentially like that. The guideline directed therapy is essentially those things. It's also tailored to the individual depending on the things that they can't have for whatever various reasons. So what is the aim of drug therapy? Well, it is firstly to prevent progression of disease. Then it's to maintain and improve quality of life, keep you out of hospital where possible, and help you live longer. So mortality reduced, that's one of the core reasons for most of these medications. And then the other things are about quality of life and improving that and making sure that you are well and thriving and out of hospital. And believe me, that is entirely possible for you. So if that's not you at the moment, please don't give up hope. Just keep pushing for getting that therapy right so that you can do the very, very best and have a great year with your family and friends doing the things that you love, because after all, that is the aim of all of this. So there are some things that you should also be aware of to help you get the best out of your medications. So these are sort of 5 tips I would recommend for managing your medications. Firstly, know the names and the doses of all your medications. Secondly, keep a list of your medications on you with the names and the dosages as well as times taken, especially for those urgent trips to the hospital. Thirdly, take your medication list wherever you are to every appointment, including to other unrelated doctor appointments like a kidney specialist or a GP or whomever you're seeing, because that list can be quite specialised, and it's really important that the other doctors know what you're on as well. Fourth, if you are having non-heart related procedures or operations, make sure that they are discussed with your specialist so that any medications that need to be changed or withheld can be done so safely and with the approval of your heart specialist. Fifth, try to understand what your medications are, even if not at a high level of understanding. I think the comprehensions of what your medications do and why they're important is key for you to understand that it's a necessity to take them. It'll help resolve any conflict you have about why you're on them. So, if you feel like maybe your medications aren't right or you really are resisting taking them, then I would urge you to discuss with your doctors why it's so important, and that might help you come to terms with that important decision to take them properly and continue them. Stopping your heart failure medications is never a good idea without discussion with your specialists. I've seen patients do this. It doesn't end well in most cases. So I would really urge you that if you feel like stopping your medications, you really have a good discussion with your specialist about that first, so that they can get a good understanding of what it is that you're resisting or why you don't want to take your medications, and then maybe they can help. Maybe they can resolve some of those issues. Maybe those medications need to be changed or doses altered, but it's really important that you don't just suddenly stop them on your own. Please talk to your doctor, talk to your pharmacist. Compliance is critical. If drugs can't work if you don't take them. So give them their best chance so that you can have your best chance of not just survival, but also well-being. Don't forget also that any over-the-counter medication can interact with your medication, so please check with your doctor or pharmacist before consuming any over-the-counter medications. That will include supplements, vitamins, pain medications, especially non-steroidal anti-inflammatories. So these are things like Voltaren or the like. Those can affect kidneys, can affect blood pressure, can affect heart. So please also check about those. This should also include, osteopathic drops, pills, and herbal formulations. And then make sure that you store your medications as they're intended. Don't leave them in heat or sunlight. So what are the other types of questions that you might want to ask your pharmacist? They might be things like, what is the best time to take this medication? Will it interact with anything else I am taking? Are there any serious side effects? Your doctors should have discussed the possibility of serious side effects. Naturally, we won't give you the entire list, and please don't read the entire list because you're only going to get frightened and probably unnecessarily. If you have something happening, however, that you think is odd and might be related to the medication, by all means look that up. By all means discuss that with your pharmacist or your doctor. Please do that before just suddenly discontinuing medication. And bear in mind that just because something happens at the same time as you take something else doesn't mean it's a causal relationship. It could be, and that needs to be evaluated further, but it may not be. So also you might want to discuss, what should I do if I miss a dose? And there might be completely legitimate reasons to miss doses. That again is something that you need to discuss with your doctors. Please don't just take it upon yourself to decide. The other thing is that if your medication is prescribed twice a day, often the reason for that is because the drug has a short half-life and it doesn't act for particularly long. So, one of the mistakes I see my patients make on occasions is they might think that a medication could just be taken both pills in the morning, say, or both pills at night, and not worry about the morning and the nighttime because that's, inconvenient. That can be a serious problem because then you get a very high peak of the drug, which can make it toxic or an overdose, and then you get this trough and it's not active for maybe a period of 6 to 8 or even 10 to 12 hours. If that's a drug like, say, a blood thinner, that could have serious consequences because either it can make your blood not clot in too excessive kind of a way, or it could stop being effective and put you at risk of clots. So please don't do that kind of thing with your medication. Please, again, discuss it with your doctors. And I've had the occasional patient make that mistake, thinking that it's quite reasonable to do, but in fact they are putting themselves at risk. There's a reason that medication is prescribed the way it is, so please take care to do that in the correct way. And if you do miss a dose, also discuss with your doctors what you should do about that, because sometimes it isn't appropriate to just take 2 the next time. In fact, often it's not appropriate to do that. The way you handle that situation will be dependent on the situation and the medication. So please get advice about that. Then I would also say keep your medication somewhere easy for you to access, but not as easy for others, such as children or anybody who might be susceptible or might make a mistake. So older people as well, make sure they're in a safe place and easily accessible for you. If you need help to remember your medications, then I would recommend getting a pre-packaged weekly blister pack prepared by your pharmacy, which is extremely helpful for understanding whether or not you've taken your doses correctly or not. It helps with, that little bit of absent-minded, did I take that medication this morning or not? I must admit, there's occasions where I will ask myself the same thing if it's been a vitamin or something like that, and I'll go, did I? Didn't I? Think so. There's greater implications when it comes to medication, clearly. In our country, we refer to these as a Webster pack, but they could be under any name, a dosette. You could even pack your own. It just depends on what you want and what's most convenient for you. And then the other thing I think is really helpful, especially if you're a little forgetful about a particular dosing, maybe you're really good at your morning meds, but you always forget the nighttime ones, or maybe you forget the ones that are after lunch. Then I recommend if you have a smartphone, set yourself an alarm. You can do that on a daily basis, and it can just go off to help remind you to take them. So I think that's a really good one to help jog your memory and make sure you take them on time. And finally, there could be, many other heart medications that you take that aren't specifically for heart failure. There's a range of these ones. We mentioned that medications say to keep the blood from clotting. There's a range of those that might be part of what you take. You may be on more medication for rhythm control or even to keep you from going out of rhythm, such as amiodarone or digoxin. You may also be on medication to further lower blood pressure. There's a whole realm of things that you might be on. We mainly talked about the heart failure ones specifically, but if you want to know about some of the others, please drop me a line and I'll see if I can do a video on that for you as well. I think, overall, medications, nobody wants to take them, but in heart failure, they're actually quite critical and they can make a huge difference to you in the long term. So I would urge you to take the ones that you are prescribed, take them as they're directed, and reap the benefits of them. Again, if there are things that you would like to ask me about that or like to learn about, please drop me a line and we'll come back next week and we'll talk about what beyond the pills, the things that you can do to help get the best out of your management for heart failure. Things that perhaps require a little more looking into, a little bit more understanding, and make every difference in terms of your survival and well-being. So I'll see you next time.